Hi, I'm Dr. Fox, and let's talk about the osteology of the neck. In this video, we'll describe the structure and composition of the bones of the neck, principally the cervical spine and the hyoid bone. The cervical spine, or C-spine for short, consists of 7 cervical vertebrae that sit between the skull and the thorax. Anterior to the C-spine is the hyoid bone. The cervical spine is of principal importance because it is surrounding the cervical region of the spinal cord. So if there are any fractures or dislocations of any of the vertebrae of the C-spine, that can endanger the spinal cord, leading to a variable paralysis or even death. Let's start our discussion with the hyoid bone. The hyoid bone sits anterior to the C-spine, usually anterior to the 4th cervical vertebrae, posterior to the mandible, and it is sitting atop a region of the respiratory pathway known as the larynx, or the voice box colloquially, something that we'll discuss in much greater detail in a subsequent video. The hyoid bone is an important attachment site for muscles of the tongue. It's also an important attachment site for suprahyoid muscles. Supra means above, and infrahyoid muscles, as we'll discuss in a subsequent video. Infra means below. Not only is the hyoid bone important for suspending the larynx, but because the airway moves through it, any fracture or compression of the hyoid can lead to an interruption of the airway, which may endanger life. More significant to the osteological structure of the neck is the C-spine, cervical vertebrae C1 through C7. There are several unique characteristics of these vertebrae that we will discuss. The first being transverse foramina. So transverse foramina are in association with transverse processes. So we can see these foramina on this representative vertebra here. These are spaces through which vertebral arteries and veins, this is blood supply to and from the cranial cavity, namely the brain, and you will have these vessels traveling through these spaces. Also unique to cervical vertebrae are bifid spinous processes. So here we can see a bifid spinous process. So that is divided in two. And this is most common in cervical vertebrae 2 through 6, as we may see in the laboratory. Of particular importance to the C-spine is cervical vertebra 1, or the atlas. Cervical vertebra 1, or the atlas, is a ring of bone, as we will see. And it supports the skull through articulation of occipital condyles at their superior articular facets. So over here we can see the occipital bone sitting atop C1 there, and those condyles are lateral there. So as the occipital bone articulates with C1, it produces a nodding appearance, as if an individual is saying yes. So those are known as the atlanto-occipital joints. So atlanto for atlas, occipital for the occipital bone. The atlas gets its name from Greek mythology. Atlas was the gentleman that was tasked with holding up the earth. Moving along distally through the C-spine, or inferior to C1, is C2, the axis. C2, or the axis, gets its name from this structure here. This is the dens, D-E-N-S, or odontoid process. Dens means tooth. And this is a projection from the body of C2 up into that space of C1. So C1 is missing its body, and into that space the odontoid process moves. And C2 articulates with C1 in that C1 may pivot about the odontoid process. So this is the atlantoaxial joint, and the movement here would be the head shaking as if to indicate no, so from side to side. So this is a pivot joint. So we've discussed the cervical spine and the hyoid bone, as well as their clinical significances. This is your summary slide. Thank you for your time.